Ew, how are you?
I'm well, thank you. Just trying to get situated in here. My dog's
Okay.
being very needy this morning, so he's whining at me. I apologize if he does that in the call.
Oh, that's okay. In fact, you know what? I'm going to shut my door because my daughter's about to come home. So hang on one second.
Oh yeah, no problem.
Ew, how are you?
I'm
I'm really
well, thank
well,
you. Just
thank
trying to
you.
get situated in here. Oh shoot.
My
Sorry.
dog's being
Let
very neat.
Okay, there we go. Um, I'm well, thank you. Still feeling like I'm kind of reeling and trying to get my feet on the ground coming back from vacation for some reason, but doing well. How are you doing? Oh, can you hear me? Hello?
I can hear you.
You can hear me. Okay.
Hear me?
Steph, are you there? Stephanie? Oh, maybe she'll come and join us in a second. I did a hangout on air, thinking that maybe in case we wanted to record it,
Okay.
um, we could do that. But now I'm trying to remember how to record it.
Hello.
But I think it records automatically. Hi, Stephanie.
Hi, how are you?
Good. How are you?
Not bad. How's everything going with the summer?
Wow, it's over, kind of,
Yeah,
for
I
me.
know. Hi, Jennifer. I'm Stephanie.
Hi, nice to meet you.
Meet you too.
How was your summer? Did you get to go back to the UK?
No. So I graduated. Jennifer, introduce myself. I'm in Sacramento, California. I graduated from the Monterey Institute in May, and I'm still job hunting. And we just got back from a big, huge family vacation in Florida. So
Oh,
yeah, and I have a toddler, a 20-month-old, almost 20 months.
nice. That's fun.
I just got him out the door, like right before I ran in.
Oh, yeah, I know that. Oh, that's fun. Well, it's so nice to meet you guys. Maureen and I were filming yesterday in Atlanta. We actually missed our flight on the way home,
Oh,
but we're able to catch the last one out, so that was good. It was a long day yesterday, filming all in one day, but it was good. We had a really good interview, and her and I were able to talk a lot about the kits and all of that. So I'm excited to get up to speed and let you guys know too, how what we've come up with, and I'm so excited. I'm thrilled. I can't wait to have this film over and just I'm just ready to share it with everybody. So very exciting.
that's awesome. And so you work for Postpartum Support International, I see as well. Is that?
Yeah, I'm a volunteer for them. It's not a paid position. Everything through them is volunteer, and what I do is I'm their Southeast Regional Coordinator. So I oversee the volunteers in 5 different states. And what our volunteers do, they're kind of the connection for the moms that need help. So when they go on the PSI website, they're able to find their state and then see what coordinators are in their state. Um,
Mhm.
so I just kind of make sure that when new coordinators come on board, that we're not reinventing the wheel. So if they want to start a support group, we have a model for that. If they're looking to do a warm line, we have a model for that.
Mhm.
So I just kind of oversee everybody, and if they ever have any questions, they have a point person to reach out to. So I volunteer for them, but my full-time paid job is with Weight Watchers. I'm a group leader for them.
Oh,
Um, I
wonderful.
work for them. That's my paid job. That's the one that that my husband likes the most because it brings me a paycheck. But I love working for them. It's a lot of fun. I went to school for communication, so I love public speaking, and so it's really fun for me to motivate people and help them with their weight loss. I gained all my weight through my medication I was on for my pregnancy and postpartum issues. So it all kind of came full circle.
Mhm.
It was like a perfect fit for me, the job anyway. So that's my paid job, and then PSI is volunteer, and of course now the film. Um, will hopefully pay off in some way. We're not looking for money. We're just looking to create a ruckus and a conversation around this. So hopefully that will happen. But yeah, it's all very exciting. Very exciting stuff.
Oh, that's awesome. That's really awesome. Okay, well, maybe we should just go ahead and kind of get started in terms of catching up while we wait for the other two. I'm going to actually email Michelle and because I have a feeling that
Michelle sent a message saying she's having some trouble logging on.
Oh, okay. So I'll send that link. Maybe that will be helpful. And then I wonder if Maureen as well.
Yeah, Maureen, I don't know if she's going to be able to join today. I know she's hosting some people in town, so she's not able to make it, and that's okay. She updated me on everything, so turn my air conditioner.
So on my first meeting today.
Yeah, I can tell that Michelle, I think, is watching because she's our viewer. This is the only problem with doing these live sessions is that even though it records it for you, it's sometimes hard to invite people to join for some reason. I've invited her a couple different ways. So Michelle, if you're watching, try your Google Plus page as well, because I think I sent it in like 3 different places. So hopefully she can get on here in a second. But this is actually the first time that I'm speaking with both of you kind of about this project live, and I think Stephanie, I don't know if you've had a chance to connect with Michelle yet officially.
Oh, we haven't met. We've just been on the email chain.
Great. And Jennifer, have you had a chance to connect with Michelle yet?
Just everything via email, just to set this call up. That's it.
Okay, great. Excellent. So let me one more thing I'm trying to get with her. Sorry. That one more time. Hopefully that works. But Michelle and I had an opportunity to chat with Maureen a couple of weeks ago before I left for vacation, and kind of got a decent sense, introductory sense, I think actually is a better way to put it, on kind of what's going on here. So I'll synthesize that a little bit for kind of all of our benefits, including my own, trying to kind of get back in this and reframing this. And so this amazing project, you're kind of looking at reframing this idea, more or less, of motherhood and kind of the cultural norms that we accept and how we talk about it and how we address it. Oh, I think this is for one moment. Hello? I can. Can you not get on the call? Oh, honey. Okay. Okay. No. Yeah, I can. That's totally fine. I can put you on speakerphone also if you wanted to just join us that way. Okay. All right, sounds good. Okay, thanks. Bye. All right, so she didn't realize that she'd be traveling right now. Her family rescheduled, so she's trying to do it on an app on her phone, and is having some problems. So she might end up just being on speakerphone on my end, which is fine. So looking at reframing the idea of motherhood and kind of what it means to be going through this early process of motherhood, I guess, is right to talk about it. And you guys are looking at doing quite a few different things in general. We really jumped all over the place. I'm going to try and do my best to synthesize it.
That sounds like Maureen.
Yeah. We had a really great talk. It was really, really fun. But we had asked a couple of important questions about, who is the audience, who are the users of this potential toolkit, what are you hoping that the outcomes will be in general. And it looked like there was kind of this multi-pronged type of thing that was happening where there's like the policy level and trying to get whether it's insurance companies or policymakers to become aware of this issue and starting to value it and talking about motherhood in a way that makes sense. And then there's the healthcare practitioners themselves so that they're educated about the issues, how to screen, making sure that they are screening women. Women know they can get screened in general. And Stephanie, for your information, a screening process is essentially, there's a couple of different, what would you call it, like surveys or something?
Yeah, screening tools that are basically questionnaires.
Yeah, questionnaires that you fill out about how you're feeling and how you're coping and whatever it might be. There's like, a series of different questions, and that's essentially the first step in a screening process. And then from there, then you can talk with your healthcare professionals about, okay, well, if I'm lower on the spectrum in terms of my status of my mental health and all these things, what can happen next? But many women don't have access or know that that's an option or that this is a problem because it's not talked about. And even if they do ask questions about, why do I feel like this? As you probably saw Maureen say in her talk, everyone says you should be happy.
Yeah.
So how can we kind of change that dialogue that's happening? So at that kind of at the medical professional level, and then of course more at the grassroots level of women coming together and creating support groups, which is a really key component of, if you look at this as like a system, if you will, it's a really key component of helping women to overcome this. Whether, and Maureen had said some women can overcome it in a matter of days and weeks, others it can take months and years, but having that kind of support group and that grassroots movement, if you will, is a really key component of it. And so there are a couple of other movies, is my understanding, that are coming out that also address these issues, although based on the trailers, I think you guys are sitting at the top in terms of how well those are coming together.
Thanks. Thank you for that.
And I know there's a couple of groups of women. Well, Maureen and I had, and Michelle and I had talked about the potential for these different movies to work together.
Yeah.
On like trying to spark a national movement, if you will, at these various levels,
Right.
through screening parties or this kit itself, whether it would be one consolidated kit or each movie would have a separate kit. And Maureen had said she was going to look into that, and I haven't heard since then.
Okay.
I don't know if I'm skipping too far ahead and not giving
I can update you a little bit on that because we had a conversation about it yesterday. So basically, there's an organization called the 2020 Moms Project in California. I don't know if Maureen mentioned it at all. The woman who does that is Joy Burkhard, and basically what she's trying to do is really try to make a big change by the year 2020 with all of these different people that we just talked about. So policymakers, hospitals, insurance carriers, doctors, and she's kind of already created like a social action piece on her website for what she wants to do. And my understanding is that she wanted to like kind of utilize this as well on her site. So Maureen and I talked about this yesterday, and I was not aware that she's actually not paying for any of this that we're doing. So I'm like, why is this going on her site? I'm very protective of stuff that we're putting our energy into. So I'm like, why do we have to do that? And so the reason that we connected her was because Joy actually works for Cigna Health Insurance, and she is going to try to get them to pay for screenings of our film. That's what she wants them to do. So my thing was, and I think she might have shared with you the website, the Escape Fire documentary. Did she share that with you?
What's it called?
It's called Escape Fire.
Escape
If you
Fire.
go to, yeah, Escape Fire Movie, I believe is the URL.com. That is like an exact prototype for what we want to do.
Oh, yeah.
They're a documentary, like, so on their website, literally it says the film, and then on the right it says the cause, and it's about the health insurance companies, actually, the health insurance system. And this is exactly what we want to do. But in that website, they have what's called a screening guide, which is basically a PDF of when you screen this film, here's how you start a conversation around it. And I'm okay with giving that piece of this kit to her, but the actual kit itself is going to live on our film's website, not on the 2020 Mom Project, unless she like funds it or something. Otherwise, this is our kit for our film, and quite frankly, we don't want to share it with the other film. There's really only one other film that's coming out. It's called When the Bow Breaks, and they don't have, from the interviews that we've read that they've done, they don't have an expert that they're working with because their stats are all over the place and it's a lot of misinformation. And so we're actually trying to distance ourselves a little bit because I don't even know how they're distributing their film, if they're putting it in film festivals like we are, or if they're doing screenings, or what they're doing. But so we're just trying to distance ourselves a little bit from them. So we don't believe we're going to share that with them. I mean, if they want to share our screening guide on how to start a conversation around their film, that whatever, that's fine, because that will probably live on Joy's 2020 website. But our social action kit, I mean, from the conversation that Maureen and I had last night in the airport, I really just think it should live on our website. Because people are going to see our film and they're going to go, okay, let's go to Dark Side of the Full Moon, and boom, here's what I can do. Not here, go to the 2020. I mean, I really think it should just live with us. Otherwise, it's going to be really confusing for people. So that's kind of what we want to do. And that, literally, that Escape Fire example is exactly what we want to do. Like, I love the icons. I love the simplicity of it. It's very user-friendly. And we want to do things like, it says, change your doctor visit. Like, that would be perfect for us. So for a mom who would click on that, this is how you should go into your OB. You should ask them, do you screen for mental health? And if you don't, I want to be screened. Here's a copy of the screen. This is what you do. So it's kind of taking charge of your own experience. And then, for doctors, here's what you can do. Put out information.
That's okay. I'm gonna just put you on speakerphone. You can listen in. We're just we're chatting. Perfect. Okay. All right. So Michelle has joined us, you guys.
Yay. So does that kind of make sense? I'm sorry, I don't want to get too personal.
Couldn't get my application working.
Can you guys hear her? Okay.
I could hear her. Yes.
Okay. Great. I was just making sure they could hear you. So I'll turn all of my things all the way up. Okay, great. So Jennifer's just kind of getting us caught up on some updates, Michelle. So they've decided that they want the kit to live on the Dark Side website itself. And they might be sharing a little bit about a screening guide with 2020 Moms Project that Joy Beckard with Cigna, but that predominantly it's going to be living with Dark Side. And then we were talking about kind of what it might look like a little bit.
Okay, wonderful.
Yeah. Okay, Jennifer, go ahead.
So what Maureen and I then talked about yesterday was to really identify the audience. So who do we want to make sure what people have what pieces to move forward? So we came up with a list, so I'm just going to share that with you. So of course we want something for moms and families. So when a mother watches this, or someone who became interested in it for whatever reason, here's what they can do. So definitely moms and families. We need to have a doctor section, which would cover OBs, pediatricians, general practitioners, just kind of all of the medical doctors themselves that come in contact with pregnant or postpartum women.
Okay.
And then therapists and psychiatrists. I don't know that we want to put them under doctors, but we need to have a section for them too, because that's going to be a little bit different.
When you say different, what do you mean?
Well, with the therapists, of course, we want them to have, training. So the doctors, doctors can receive training too, but we were going to kind of have a separate section for like medical students. So that would be different than doctors. So if you're a medical student, this is what you need to do. And they have an escape fire, an example. I think it's medical training. I think it says something like that on their website. So that would be an idea for, medical students. And then the childbirth community. So we've got a whole laundry list of people that fall under that, which would be doulas, midwives, lactation specialists. And this could maybe be simplified into just, get trained, or, we really want to have those catchy little phrases like they do on the example I gave you. And then, of course, we need one for possibly for insurance. And Joy already does this on her website. Like, she tells the insurance companies what they can be doing. She tells the hospitals what they can be doing. We would like to have a section for legislators. How can, like, maybe a legislator reads this film who's into women's issues and is like, okay, what policies have already been established, like in New York or New Jersey, where it's already mandated screening in those two states. We're the only two states that mandate screening. And maybe even a media section. So how can the media talk about this? Because that's a big, big issue. We've got the media throwing around terms like postpartum depression, but it's really postpartum psychosis, which are two completely different things. Those were kind of the pieces that we came up with. And then underneath that, that's where we need to come up with, and that's where I'm going to interview some people and talk to them about what would you like to see under, if a mother goes on and clicks on, moms and families, what are the 5 steps that they can do to take action right now? Right. Okay, so those are the pieces that we want to build, and really, I love visually the design anyway, the way it looks on that Escape Fire movie website. It's just something very simple. I don't want anything too complicated. Right. Something really simple. I know on their website they call it the first aid kit. Right. That was their. We were throwing around some things yesterday. I said we should call it the diaper bag because it's baby stuff. It should be like a diaper bag of stuff, right? So those are like the little cute things too that we want to think about. Just a creative way to do it that is kind of fun. But I do need to do, and I'm going to do that this week, some of the interviews to find out what then are the 5 steps underneath each of these audience members, that might go to our website and then want to do something in their community or whatever it is. And then, of course, we need to have a place for them to learn about how to host a screening. That would be obviously the ultimate goal, is that we want them to host a screening, and that's where that guide comes into play. And they have a guide on that website, so it would be a great thing to kind of just look at and see like what we could add. And of course, can get you all there's a facts section, and then so I can get you all the facts for maternal mental health and all of those, and then of course the discussion questions around the screening. But that's really what we talked about yesterday. So it's just kind of figuring out how we can set up the kit so that it's user friendly, because it's a lot. Like Maureen didn't want to see like an icon that said lawyers, click here. Like, she really likes the change your doctor visit. She wants to see the direction as the first kind of impact, instead of here, if you're a lawyer, click here. She's like, no, I want to, and I'm a very A-type organized person, so that's the way my brain thinks. She's kind of the visual, like, no, this is going to be the most impactful. That's why she's the documentarian and I'm not. That's kind of where I think we need the most help with just the wording of how can we put that so that people, become engaged and want to click on it, and it's easy for them to use. Does that make sense?
Yeah, absolutely, and it crosses a lot of the things that kind of we already talked about with Maureen, because we had tried to hash out some of the audience with her, and I think we hit all of these as well.
Okay.
And Michelle and I had originally talked about really taking a human-centered design approach to this in terms of, like you said, you're going to go and do some interviews on what are those 5 steps, maybe doing some rapid prototyping and talking with doctors and saying, doctors that already know about this and who talk about this with their patients, and then those doctors that don't, or therapists or doulas, whatever it might be, and really trying to connect with these potential users and design something that's going to be utilitarian. I think Maureen probably already told you, I don't know if we have an overwhelmingly high capacity for design. Michelle has a decent amount of experience in web design and whatnot, and I think we're going to be weighing on her pretty heavily, but just in terms of kind of managing expectations on what it could potentially look like, I don't know if us alone are going to be able to get that kind of quality for Escape Fire, but maybe maybe I'm setting the bar a little too low. I don't know, Michelle, you can pipe in on that if you think differently. Is she still there? Yeah.
Yeah, no, can you hear me?
Yeah, so go ahead.
Oh, yes, and I hope there's not too much of an echo. Because when I spoke with Maureen, we had talked, we had a follow-up conversation, Danielle.
Oh, great.
We were traveling during, we had spoken about that she wasn't maybe specifically looking for us to develop out that programming or that design and development, because she understands that that's something that will need to be fleshed out by a programmer.
Yeah.
But more the in-depth layout of where each clip would go, what information would live where, and how that flow would be, and so the overall design, but then get up there and actually have it developed out. So that was something that I think she was going to reach out to. I don't know exactly who it was it someone on her team specifically, or she had someone in mind of a friend. But that was my understanding from the last time we spoke. I did explain to her that programming-wise, we could do it in a basic site like WordPress or something, but I think this is something a little more intricate that we would need done, if that makes sense. Yeah,
absolutely, and that's awesome. I'm glad that you guys had that conversation. I feel much more confident in being able to do those types of wireframes, as opposed to the actual programming. So
yeah, no, I'm sorry. I probably and that's exactly right. Like, we just need to see like examples, not necessarily implementing it onto the site. You guys, just kind of that idea of what visually would be the most, user friendly. Because I don't think that. I just don't think that way. I always skip steps, and like my brain just, I can't, I make it too complicated. Brain's like, simplify it. And I'm like, I just can't, because I want to give them all the information. It's just like, no, it needs to be simple. Very small statements, and it's exactly what Escape Fire did. And I think it's it would be a great thing for our audience, just because our audience is so vast. I mean, you're talking moms to scholars to lawyers to, there's going to be such a realm of people. So I'm just thinking, making it as simple as possible is probably the best way to go. And the other thing, I wanted to mention the timeline for this, because we were talking about it last night. We are entering this into the Sundance Film Festival. That deadline is September 27th. When it gets chosen to screen there, because we're talking positive, when it gets chosen to screen there, that will be its world premiere. In fact, you can't screen any films at Sundance unless it is a world premiere. It cannot have been screened anywhere else. So that's why we're really trying hard to make this deadline, because if we miss it, that means we can't screen our film for an entire year until Sundance hits next year. So, so we are going to be done for that. If it, in fact, screens there, we wouldn't be able to even launch this piece and other screenings until after that. So our timelines now probably are closer to December, because Sundance isn't until January. And I told her, I said, well, that's all fine, but we're going to start working on this now, because I can't have the film be done. It's the holidays around December. I mean, that's just, I'm like, let's just work on it now and get it finished. So, so I just want to let you know that. So we have more time, is what I'm saying, which is a good thing. for us to kind of figure this all out. We will know in December whether or not we've got chosen for Sundance. So then we'll have a better scope. But yeah, as far as the implement of the design, yeah, I mean, Maureen was even talking about really simplifying it. I do our website right now, and I use Squarespace,
Right.
and I have a friend too who's does some web coding and stuff like that. So we just need to see what it will look like visually.
Okay.
Things you can do for us, like with that, and then we'll get somebody to put it on the site.
Okay, great. Well, those are good updates. It's nice to hear that we have till December. I think we'd want to set an internal deadline for much earlier to the best of our ability so that the programmer would have ample time to kind of put all this together and we can continue to prototype and iterate these guides, if you will. Michelle, maybe you could go into kind of any other updates that you might have. 'Cause I know you had a couple conversations and stuff while I was gone.
Yes, can you hear me again?
Yep, go ahead.
Sorry, there's an echo. Yes, so Maureen and I, we had, well, I had done the conversation with Liz, and we had a follow-up conversation. Maureen spoke specifically with Liz, but getting more in depth of what it would look like. You know, she was expressing to me that maybe a pregnant woman wouldn't be the complete target audience for watching the film, but also wanting that mothers of any stage being able to have access to the toolkit. So kind of in this human-centered viewpoint of really being sensitive to who's looking at the material from, of course, the doctors and the healthcare standpoint, but also thinking about what mothers might encounter this toolkit and the resources that would live there. They also just discuss the relationship of, what partnerships could happen by driving this information to different sites that already have material, like Mother Woman, that, have extensive training and where they could go to get that. So there was certain areas in which Maureen foresaw that connection happening, and then trying also to set up more interviews, which has been a little bit of a struggle with timing right now, but that is something that we're hoping to do the following week to really get these interviews happening very quickly, because with the user center kind of perspective, we need those interviews to happen so we can really move forward considering our time frame.
Yeah, absolutely. I couldn't agree more.
And yeah, so that's about where we had reached to. But I was also saying that I would love to start those mock-ups, but I also know that we want to embrace the interview part. But I also feel we might need to move forward with certain things more quickly. So that was what we were also discussing, but trying to wait to speak with you, Danielle, to see how you felt how fast we move forward.
Yeah, no, you guys, I mean, I think it would behoove us to drive as much forward as possible, as early as possible, so that we can start to, like I said, just iterate this, because you're never going to get everything right the first time anyways. So it'd be great to try to start getting some ideas down, and then being able to fill in the gaps with these with this qualitative data, I guess I would say, with the interviews and whatnot. So I think that's a great next step. So Jennifer, you had mentioned that you have some interviews that you're interested in doing.
Yeah, I mean, I need to talk with Wendy Davis. She's the executive director at PSI, and what they really do, they do trainings. They train professionals, nurses, psychologists, psychiatrists, OBs in maternal mental health. So they have a 2-day training that they do. Mother Woman, they do trainings as well for support groups. Like they train people on how to start support groups, and they train support group facilitators. So that's definitely someone that we're going to want to include. Obviously, and that's Liz that she was talking about. We want to include her. We had an interview yesterday with Catherine Stone, who is probably, like Maureen said yesterday, she is the Oprah of maternal mental health. I mean, she truly, everyone knows her name. They know her name more than they know PSI.
Mm.
Even though PSI technically is the national organization
Uh-huh.
for maternal mental health, that's the other big issue with this entire cause, is that there really is not one head honcho. Like the best example to use is Susan G. Komen. Everyone on earth knows that Susan G. Komen and pink ribbons is breast cancer. We don't have anything like that for maternal mental health, and I think that's a really big issue. A lot of people have tried to do something, but it just doesn't work. I mean, when I say, so what's the color from what's the color from purple? Well, no, there's white ribbons, but then it's pink and green, because green is mental health and purple is like, oh my gosh, like we can't. So there's no one powerhouse that's making decisions. The reason why is because there's no money in this. Like, nobody funds mental health, let alone maternal mental health. So that's been the big difficulty. But anyway, so yeah, I want to interview Catherine Stone because she's more of the social support piece for moms. She probably has. I mean, she's the most read maternal mental health blog in the world right now. She gets enormous amount of traffic to her site, and it's Postpartum Progress. That's her site. So I want to talk to her to see what she would like to add to this kit as far as the social piece. We certainly would want to include links to her blogs and connect mothers that way. So yeah, support groups are a big thing, and PSI and the trainings are another big thing. And so, like she was saying, there are links that we're not going to have to reinvent the wheel when it comes to, you know, if a doctor wants to find out more about getting training for maternal mental health, there's already somebody that, you know, there's already an organization that does that. So that would be a link, and they would click on that, and it would go, you know, to wherever that site is. So that's kind of why I need to do these interviews and kind of just figure out, okay, what are all the pieces underneath all of these different audience members that we're trying to reach, and if they want to take action, how do they do that? So Wendy Davis I have to interview. Catherine Stone, definitely. I'm probably going to have a separate conversation with Liz to talk to her more about how we can incorporate Mother Woman into this. And then for policy changes, there's a woman in New York, Sonia Murdoch, who is really the woman who got the legislation passed for mandated screening in there. And then even for hospitals that want to start a day program. There's a day program in Rhode Island. So I want to talk with her about, okay, if I have somebody that wants to start something, can we link them to you so that you can so we're not reinventing the wheel. 'Cause the biggest reason why people don't start something is because they think and look at it and go, there's no way I can tackle this. But it's been done. And so, like, even the inpatient psych unit at UNC, every hospital should have a perinatal and psych unit for mommy and baby. And they have one there. So we could link to UNC if a hospital wants to start, an inpatient unit. So these are all the different players kind of in the game that have already done something, and we need to talk to them and say, hey, we're going to design this toolkit. How can we, and are you okay with us linking to you so that we can really show people that it's possible. Here's how you do it. Step 1, 2, 3, 4, 5, and here's the person you can contact. So yeah, that's the short list. Everybody.
Okay. Well, I think if we can all get on the, sorry, I have to plug in my computer. I think if we can all get on the same page about kind of, what steps in terms of this project you guys are taking, Jennifer, and then I know, in terms of action items and kind of where we're going, Michelle, and I don't, correct me if this has been updated since the last time we chatted, but we have kind of like a, I don't know what you would say, action steps, and I think we need to sit down and maybe as a small team decide what all of the foreseeable steps are going to be in the kind of first phase of this project, prioritize them, look at the low-hanging fruit, what can we crack out now, what can we start putting together in terms of this resource hub so that we have all of the, the data and resources in one spot, and then we can more easily decide where they link to and kind of do that information architecture as part of the wireframing for this. And then cracking out these interviews. Michelle and I had also talked about doing some personas to try and better understand how users might engage with this toolkit at the various levels. So I think we have quite a few things that we can get started with pretty soon. We'd also talked about doing a couple of brainstorming sessions. Maureen had mentioned that you guys are looking at potentially renaming the film.
Yes.
Okay, so I know Michelle and I are really interested in brainstorming and design thinking methodology, so I know each of us would be really interested in having kind of an online brainstorming sesh. I really wish we could all be together to be able to do that, and maybe us three ladies here in California could try and come together and do something like that, as well as maybe a Saturday or something, but as well as doing some brainstorming on visuals and how to put this information together. So I think we have, I don't know, correct me if I'm wrong, ladies, but I think we have some good first steps for sure that we can start working on to get the ball rolling on this a little faster, if you will. Does that make sense?
Where's Michelle based?
I'm sorry?
Where's Michelle based?
Michelle's based in Mountain View area.
Okay, so she's not too far.
No, and I think it's probably a little bit easier for me to come up towards you guys, maybe.
It's like an hour away from Monterey.
Yeah. So maybe we could go up to the Oakland area, or meet somewhere in the middle, Michelle or Stephanie, so that you don't have to drive 4 hours down to Monterey either. But we could do something.
Not that I would be complaining. It's like 108 over here.
Yeah. Okay, that sounds good. Well, Jennifer, what do you think is the best? Sorry, I lost Michelle. What do you think is the best way for us to be in communication together about these interviews and kind of the steps that you're taking? How can we put this information together based on kind of what you're doing and what we're doing? Does that make sense?
Yeah, I mean, do we want to start like a Google Doc or something that's live that we can all kind of work on and see, so I can just keep you up to date with anything? I mean, does that sound like a good idea, or?
Yeah, Michelle and I have a Google Doc going. Stephanie, I just invited you to it. And then I also have, are you familiar with a project management tool called Redbooth? It's a little bit new. It's only a couple of years old.
No, I'm not.
So
Hang on, more. Press what?
she's gone. Okay, so Redbooth is just a project management tool that I'm a pretty big fan of, and it has, task lists, and you can do notes and conversations and all kinds of stuff. And so I've started to populate a project on Redbooth with that. Maureen's been added to it. I would be more than happy to add you as well, and I think that's going to be a good place to have a hub. And then there's a plugin for it for Google Docs.
Okay.
So we can still do collaborative type work there, but kind of having a hub be on that project management site, if that works for all of you.
I'll use anything. We don't even have to use Google Docs. If you just want to primarily use Redbooth, that's fine with me.
Okay, yeah. Michelle and I are in different camps. She really loves Google Docs, and I am not as big of a fan, unless you're having to collaborate and co-edit and things like that. But I think it's just because I got overworked with Google Docs in grad school.
Yeah. Okay. That's okay.
Yeah, Stephanie, you're on the same page as me, I think. So we can kind of figure out a system as we go along. I haven't written out, aside from the questions I had originally asked Maureen, I haven't written out interview questions or anything else like that, so I don't have anything like that to share, but something like that would be nice if we had like a folder with all of the interview questions that we're using, and something else like that would be cool. I know you can attach files. I like to record conversations that I have a lot of times, so you can go back and listen, other things like that. So you can do all that on Redbooth. So I'm going to make the strong recommendation that we have that be our main base for this project. And I'll add you to that as an administrator as well, and then use Google Docs and whatnot to maintain resources or anything else as we need to.
Okay, that sounds good to me.
Great. So I think what I would love to do is, it sounds like we're not going to be able to get Michelle back today, Stephanie, but I would love the three of us to connect here in the next couple of days. maybe even tomorrow, if she's available and you're available, and kind of hash out, really articulate what our steps are going to be in prioritizing, and like I said, low-hanging fruit and all kinds of other stuff like that. So, or Jennifer, if you'd like to be a part of that, you're more than welcome. Otherwise, I think we'll just kind of start cracking down on this, since you guys have a lot of editing and all kinds of other stuff.
Yeah, and I'm always available. If you need to text me, email me, I always have my phone with me. It doesn't matter what time. I know there's a time difference, but that's okay. I'm like up all the time. So just reach out if there's something that comes up and you're like, oh my gosh, I need to know whatever it is. Just really seriously reach out, because I'll get right back to you.
Okay. That's great. Well, Stephanie, if you'll stay on the call for another minute. But Jennifer, it was such a pleasure to meet you. I'm so sorry that Michelle didn't get kind of more of an introduction, and I actually think that I did a pretty bad job of introducing Stephanie in general. So if you have any questions, don't hesitate to let us know.
That's the great thing about social media. I can just read profiles, and you feel like you pretty much know people before you even meet them, which is like so interesting, right?
Yeah. Well,
yeah,
I think my whole life is about me, since we have known each other for quite a few years. So I was a little bit banking on that. But Stephanie, I'm sorry, I didn't even.
Don't worry about it.
You guys are cute. I love it. All right. Well, I will go ahead and leave the call. But seriously, if you need anything at all, just let me know. And I look forward to seeing this Red Booth management system, because I like to learn new little systems too. I'm kind of not a huge Google Doc fan either. I feel everyone knows Google Docs, so that's why I use it. But something new is always good. So.
Yeah. Well, there's never going to be apparently a perfect project management site, so I continue to use new ones all the time, and this one is okay right now.
Okay. All right. Perfect. It works for me. All right, ladies. Thank you so much.
Jennifer.
All right. Bye-bye.
Bye. Okay, great. So how does it, we went through that really fast, and I know I'm like catching you up, and so I want to answer any questions that you might have about the project or where we are or anything else. I'm really sorry that...
Oh, no problem. I got a lot of it, and I looked at all the resources that they'd sent. I looked at all those resources that they sent in the emails. I watched the trailer for their film. I checked out Escape Fire, and there was one other one. I can't remember what it was.
One of the breaks, I think.
Yeah. And I got a lot of, what Jennifer said of who the users are, who we need to call to action, what she wants in the kits. All that makes sense to me. But I'm unclear on first steps and what stuff we should be doing and what stuff they're doing, and they maybe pass on to us. I'm not sure. Are we doing interviews with stakeholders, or is that not our role? Or are we just processing the information that they give us?
That's a really good question. So when she said she was going to do interviews, that was actually the first time I'd heard that. I thought we were doing all of that kind of stuff. Okay. So that's something, I also had the same question, but I figured I would just parking lot it until we figured out kind of what our capacity was, if you will, and how much time and commitment and everything else, because, didn't want to assume one way or another that either group can handle either side. That's kind of why I mentioned the whole project management and how we were going to work together on this, because I was like, oh, okay. But I think it'll be great if maybe we're both contributing in terms of these resources and everything else, and doing these interviews, because I think there are a lot of them, to be honest.
I have a couple ears, actually. One of my closest friends is in the mental health field. She's a therapist in marriage and family therapy, and she's getting her doctorate. So she's a practitioner and she's a student.
Awesome.
And so it kind of rang to me when she said we need to tell students what to do as well in these sort of call to action kit. And my old boss is a psychologist. I know people in the mental health field, and maybe it would just be informative to interview them for our purposes, even if they can't contribute to the site. Maybe they would give us a bigger landscape or something.
Yeah, and that's honestly, that's what I was thinking too. I have my best friend's an RN in PD, pediatrician, so I asked her about this, and she was like, oh yeah, I know about it, but that's, and then her dad's a psychologist, and I asked him, do you deal with this? And he was like, no, I deal with crazy people, and I was like, well. He's a big jokester. So I'm going to have a conversation more in depth with him. And I think that within our own networks, there's a lot of opportunities. Michelle knows of this really great, women's support group that's in the Oakland Bay Area that has like doulas and midwives and all kinds of stuff. So I think in terms of first steps, our assumptions were, and I have some of these first steps on we're essentially, looking at doing this through a design thinking methodology framework, if you will, and human-centered design. And so right now we would consider ourselves in the empathy stage and figuring out, what are these potential users, what do they currently know about it, what do they want to know, how do they want to know that, where do they want to find it, all of that kind of the user's needs, if you will, and doing Maureen already has a pretty in-depth problem tree and problem analysis kind of put together in terms of research and learning and background and all of that kind of stuff. So we're ahead of the game in that sense. And now we need to put together, I think, an interview process for gathering this type of information from these professionals and potential mothers and other practitioners and insurance companies, all that kinds of stuff. So that's what we foresee as being the first really important step in taking 2 weeks to do as many interviews as possible, or focus groups, maybe even longer than 2 weeks. I was thinking originally that we had really a month to do this, which seemed really absurd to me. Not absurd in the sense that how could they expect us to do this, but just that's a short timeline, so I was trying to manage expectations in general. But I think now that we have a little bit longer to do this, I think we can put something together that's really useful. We had talked. Yeah, we had talked about some other low-hanging fruit types of things, like this research hub she was talking about. So being able to better understand how can we help people to get to those different places, either once they've seen the film or once they know the film, kind of like she was talking about with Escape Fire. So maybe putting a doc together of resources that we think most important to least important, or most important to mothers, most important to doctors, or we can categorize it and change it around how we see fit. And again, we'll have to prototype it and see what happens based on these personas and potential users and whatnot. And I think because we are kind of well connected, women and doctors and other things like that, the three of us specifically, and then of course with Maureen and Jennifer as well, we will be able to kind of do some rapid prototyping with this, which I'm excited about, so that we can create something that's really utilitarian. So I think that's kind of where we stand in terms of my assumptions on what our first steps should be. So designing, essentially articulating what this methodology is going to be for the interviews, and then carrying them out. At the same time, Gantt chart style, at the same time, putting together this resource hub that Maureen and Jennifer already have a lot of these resources. So it's just a matter of getting them to, brain dump on what these resources are in a meaningful way that we can kind of filter out and work through.
Yeah.
How does that
Cool.
sound to you?
Sounds good. Even after all that, I'm really not sure what we're doing next, but maybe you're not sure either.
No, not really. Here's a proposal. Why don't we just kind of try and decide maybe what would be an okay next step? So I think, why don't the three of us try and connect in the next day or two, and hash out some questions.
Yeah. Let's. I've looked at the Escape Fire site, but I haven't deep dived into that. So if I did, maybe that would be a little bit more insightful.
Yeah, me too. I had forgotten that I had looked at it because I did not deep dive. So I'm gonna make a note on this Google Doc. So next steps. So we each need to deep dive into the Escape Fire. Okay.
Is it as simple as thinking, okay, like you said, we're well-connected people. I know people in the birthing community. My friend's mom's midwife. I had a birthing coach. I, know people in mental health. Is this a time to start just asking them questions to think about them as users?
I think so, and I guess that's kind of what I meant when I was saying put together a methodology. Um, yeah,
Yeah.
thinking about them as users and asking them questions like,
What would you want to see, or what do you already do, or etc.
what do you know? Who do you know? How do you go about this? Like, is it something you're interested in? Um, how do you get your information? Kind of the whole. I really was thinking about this, kind of like we did the AR curious person.
Yeah.
Really developing this personas based on real interviews for how people could potentially, or how this could potentially be used, or not used, or whatever it might be. That's kind of was my assumption on how we go about this at the beginning. So putting our heads together, like who are we, creating a list of who each of us individually are going to be interviewed. What types of questions are we going to be asking them?
Uh-huh.
Maybe
a methodology will emerge, you think?
I think so. I don't think we're gonna be able to hash it out, but I would feel more confident personally. If I'm gonna go talk to some of my pediatrician friends, if I know that you're asking, psychologists a couple of specific questions, I would like to maybe also ask those questions to the pediatricians to see if the answers are different or how their worldview changes based on their, professions, other things like that. So maybe getting on the same page on core questions that we might want to be asking them, or what our goals might be for developing these personas, perhaps. But not having a strict regimen by any means. But I think I would just feel more confident if I had a better sense of what
we should be asking.
Yeah. It's this whole getting comfortable with the unknown and this action research style kind of a thing. So yeah.
My best friend's name is Teddy, and I was just talking to her about this project that we're working on, and she said a documentary such as Dark Side of the Moon is something that they would show in class to people who are getting their degrees in mental or marriage and family therapy or whatever.
Cool. That's awesome.
Yeah.
That's another thing that I don't. It sounds like maybe the scope of this has changed a little bit, but one of the things that, maybe not. One of the things that Maureen and Michelle and I had originally talked about was, how do we do the screenings? How do we get it out? How do we tell those professors that they can screen this?
Yeah.
That kind of thing. So that's a component of it. I think that's a great question to ask, like you said, with students, with Teddy. How do we get that? How do we market that in a way that's meaningful? And I think, again, another reason that Darkside doesn't want to be affiliated with When the Bow Breaks, because they do use, like Jennifer said, wrong stats and other things like that. So. Okay, well, why don't I send an email? Oh, poor Michelle, they're lost. She can't call back because they're trying to figure out where they are. So why don't, are you available at all tomorrow?
Yeah, I am. I have tomorrow. I think tomorrow's wide open.
Okay, because if it sounds like Michelle's with family, so I don't know if she'll really be available, because Monday morning might also be good for me if it's good for you.
I'm still job hunting, so I'm pretty much home most of the time.
Okay.
Only thing is sometimes if my husband's just starting his new job,
Right.
So as long as someone's there to watch Dylan, I can jump into this kind of stuff. But I have evenings and stuff to catch up on emails and do homework and all that stuff.
Okay.
But, what else was I going to say? Oh, next weekend from the 8th to the 10th, I'm going to be gone.
Okay.
It's our 1-year anniversary and we're going to Vegas.
Oh, that's very fun.
Never been before, neither of us. So we're just going for 2 nights just to check it out and have a good time. So.
Yeah. And you're leaving Dylan with your folks.
Yeah.
Nice. Oh, you guys are gonna have a great time.
Yeah, it's gonna be fun. So I'll be gone from Friday night to Sunday night.
No problem. Not a problem at all. I have a feeling that I don't know. We'll figure this out.
Yeah.
We'll come together as we can. So I'm going to propose. My colleague is taking. She has how old is her baby? Her baby is like 7 months old, and they are supposedly going to take a spa day and leave Cora with me. And I don't know exactly what time that's going to be because one of the moms, my colleagues, one of the moms is a little bit apprehensive still about leaving her with like strangers. They're not quite ready yet. And so I was like, hey, no, I won't take it personal. I just need to know what time, and they still haven't gotten back to me. So why don't I email you guys, and I'll text her right now and ask her what time she was thinking of going, and then maybe we can schedule something around that.
Okay, cool. Sounds like a plan.
And then we can kind of all get on the same page again. You guys can officially meet. I think Michelle is amazing. I am a super, super big fan of her. Hopefully you will also really enjoy her. She's got some great ideas, and she's an amazing facilitator.
Cool.
Yeah, she's an amazing facilitator. She worked at the DLC the whole time she was a student, and worked with Lynn McDonald, with Girls Health and Girls Hands, and has done all kinds of stuff, so she's awesome. All right, I'll get with Molly, see what time I have this baby, and then I'll get back to you about when we can connect again. I'm really excited to be working with you on this, Stephanie.
Ooh, I'm stoked. I'm so glad you thought of me. I'm really excited about doing this.
Oh, good. I'm so glad. Yeah, this is a super exciting project, and I don't know, something I'm very grateful to be a part of, for sure, as a woman.
Awesome.
Awesome. Okay, well, have a great rest of your day. I'll talk to you hopefully tomorrow.
Okay, bye-bye.
Bye.